Since nursing school, we have been taught to protect your license, but not many of us have been given the information to keep it safe. Hey, my name is Nurse Key, and I'm taking the sting out of being a new nurse. So I want to go over 3 levels of nursing authority so you can find your information to keep your nursing license safe and your patients even safer. So three areas of where you can find your nursing scope of practice, and all 3 are essential to keeping your license safe. 1, the State Board of Nursing. 2, your facilities, policies, and procedures. And 3, your unit standards. So the State Board of Nursing, every state is going to have their own Board of Nursing website. You're going to look on here and look up your Nursing Practice Act. Every state has their own parameters of each nursing type, whether it's registered nurse, LPN, or even advanced practice nurse, of what are the parameters that each nurse can function in their state. These are essentially boundaries about professional conduct, documentation, delegation, medication, and narcotics, of like how to handle them. And then your facility, more specifically, number 2, your facilities, policies, and procedures, which should be on every unit. If not, it's online for that hospital's systems website. But if you can't find it, ask someone. The facilities, policies, and procedures go a little bit deeper in each of those pillars. So not only does it talk about professional conduct, but it'll say, okay, well, this is what you can actually wear to work. This is what this facility deems professional for our nurses or our staff. Some facilities wear certain scrub colors, so you need to know each facility's code of conduct. They're going to go over even documentation, what their standards are, what system do they use, which charting system do they use, how to document admits, discharges, daily rounding, and then status changes, even special meds and how to handle them, or narcotics, and infection control. Then from the facility number 3, you're going to go to your unit standards. So every unit has a certain way of functioning, and it has its own culture. I know in critical care, sometimes you have to have your whiteboards completed by 10 a.m. and then also like a fall assessment board on the window. So it kind of helps the social worker team or even PT and OT. So there are certain things per unit that you're required to do, to chart on, even to prepare for some units have rounds or huddles at a certain time. So you have to know each category to kind of be a successful nurse on that level. So again, it's the State Board of Nursing. Look at their website and see, okay, in this state, how does a nurse function? Because, for example, in Georgia, LPNs they can start IVs and they can give IV push, whereas some facilities at one time, like South Carolina, they're not able to start IVs or do IV push. So per state, you need to know their parameters of how you can show up as a nurse, especially if you want to travel. It's not, it wouldn't even be appropriate to cross state boundaries if you hadn't looked at their specific state Nurse Practice Act. So I hope this helps.